Good afternoon, everybody. My name is Mary Kagujje, and I'll be presenting the diagnostic accuracy of a novel point-of-care urine LAM test for the detection of TB among adult outpatients in Zambia, a cross-sectional study. I'm presenting this work on behalf of Dr. Monda Mioyeta, Dr. Andrew Karkoff, Lofina, Emmanuel, Samuel, and Morton. So first, I'll take you through the current LAM that we have, and then the LAM that we're evaluating. So currently, we do have the lateral flow LAM, which is a rapid low-cost point-of-care test. And it looks almost like an HIV test. You will see it on your left. This test requires minimal training and lab infrastructure, and it detects LAM, which is part of the TB cell wall in urine. Overall, it has a very low sensitivity. However, among people who have advanced immunosuppression, especially people living with HIV, we do see that there is moderate sensitivity. This test has been shown to have a mortality benefit because it's a point of care test and allows quick decisions on diagnosis of TB. Studies have shown that in settings where LAM has been used, there has been a reduction in TB mortality. This test was approved by WHO in 2015. However, in 2019, we had an update allowing for use among a bigger group of people living with HIV. However, its scale-up has been limited in so many settings because of the low sensitivity. So new on the market is FujiLAM, which is a next generation LAM test. And it looks like just like on the picture on the left. And this tool has been demonstrated to have higher sensitivity than the lateral flow LAM. And we are looking at 71% compared to 35%. And the tool, the LAM test is also useful both in people living with HIV, both people living with HIV with higher CD4 counts, but also in the HIV negative population. What is important is that at the time the study was started, all the available data had been based on biobank samples. So this study was done to determine its performance using fresh specimens. So it was conducted in Kanyama and Chainda among adult outpatients with presumptive TB, both in the HIV positive and HIV negative populations. And all the people who were recruited onto the study were consecutively enrolled to minimize any bias. So all these patients submitted urine for FujiLAM, and the people who are testing for using the FujiLAM were blinded to other test results. Patients also submitted sputum for smear microscopy, expert ultra, and Mycobacteria tuberculosis culture. Our reference standard for this study was sputum culture. So 183 patients were approached, and of those 157 consented to be part of the study. Of the 157, only 151 had complete results, and of those who had complete results, 34 had TB, confirmed TB, while 117 did not have confirmed TB. We had, of the patients participating in the study, we had 59% of them being male. The median age was 37. 46% of the patients were HIV positive, and 21% had a previous history of TB. And among the participants, the TB prevalence was 23%. So in terms of the accuracy of FujiLAM relative to the gold standard, it had an overall sensitivity of 77% and an overall specificity of 92%. When we compared FujiLAM to smear, it actually performed better. FujiLAM had a superior sensitivity of 77%, while smear microscopy was only at 44%. Further analysis looking at smear positive and smear negative individuals, we see that among smear positive individuals, the sensitivity was 87%, while among smear negative individuals, it was 68%. So looking at the performance by HIV status, among people living with HIV and among the HIV negative, we see that the sensitivity was actually similar. And then much as the specificity was slightly higher in the HIV negative population, the difference was not substantial. As you can see, we have overlapping confidence intervals. So in terms of strength for this study, this was the first prospective study done to evaluate FujiLAM using fresh specimens. And then we see that the study has a high sensitivity and specificity among ambulatory patients, and it performs similar in terms of sensitivity and specificity, both among the HIV positive and the HIV negative patients. Also, we see that its sensitivity exceeds that of smear microscopy by 32%, and it actually detected more than 2/3 of the smear negative TB cases. However, there were some limitations. For example, in our sample, we didn't include extrapulmonary TB patients. There was no systematic sampling for that. And also, we could have compared LFLAM with FujiLAM, but that was not undertaken, so there is no direct comparison. And also, we did not systematically determine patient CD4 counts. So in conclusion, FujiLAM could significantly improve point of care TB diagnosis in resource-limited settings, especially those where expert remains unavailable. And at the moment, there is a large multi-country diagnostic accuracy study to confirm the findings that were found in our study, and results will be expected in 2022. I would like to acknowledge the CIDAS team, Paul, Winnie, Joel, and Kaunda, the Ministry of Health team, and the study sponsor who is FIND. Thank you very much.